sequencing and understanding the patient's genome can save lives. I mean, there are certain mutations in epilepsy that just require vitamin supplementation, and the seizures go away. And that can often get in the way. You might put them in CBD and not notice that for 6 months, and then they end up honeymooning out of it, and it really turns out they just actually needed vitamin B6 or B12 or folic acid, or they need to be on a ketogenic diet because they have glucose transporting mutations. There's a host of, there's at least like 24 different forms of genetic epilepsy that are actionable based on the genome itself, and they may not always lead you into benzos or cannabinoids. They might lead you into a path that doesn't even involve these compounds. So we think it's very, very valuable. The challenge is cannabinoids right now sit in this really weird legal conundrum where it's difficult for doctors to prescribe them. It's even more difficult for you to have a genetic test that actually tries to look at the variants and make informed decisions on which cannabinoids to potentially use, or if to use them at all, because there's a lot of FDA scrutiny on direct-to-consumer genetics.
Right.
There shouldn't be, but there is. They don't like having patients enabled to make intelligent decisions. They want that all to be channeled through the FDA-appointed medical school doctors, and that doesn't scale. It's important that physicians obviously are very well trained and know what they're doing, but the better thing is to make sure all the patients begin to pay very close attention to their health, because there's no one who is more vested in the outcome of their health than the individual, and arming them with information, in my mind, is always a good thing. But they don't see it that way yet. And so they have been cracking down on a lot of companies that do direct-to-consumer genetics if they ever imply that they're going to be used for medical decisions. 23andMe was one case of this, where they just got hammered by the FDA, and they kind of sent a signal through the field that if you do any of this without going through the FDA, we're going to come down on you. So we for a while we're looking at panels that would genotype patients and try to discern, whether they had like an MTHR mutation and they should go one direction, or whether they had variants that might predispose them to opiate addiction, because there are some known that increase your likelihood of opiate addiction, and that it might be that might coach you in the direction of cannabinoids. But I think the sequencing needs to get a lot cheaper for that to happen, because right now it's probably a couple $100 might be better spent going to a dispensary and just experimenting with different CBD and THC ratios until you find something that actually works, because the science we have around the genotypes is still, I wouldn't say it's fuzzy, but it's early. It's very early correlating these genotypes to outcomes.